All right, let's talk about something that's becoming absolutely critical in managing hypertension, home blood pressure monitoring, or HBPM. If you're a clinician in training, listen up, because getting a handle on this isn't just a nice to have anymore, it's a must-have for giving your patients the best possible care.
So here's what we're going to cover. We'll start with why clinic readings just aren't enough. Then we'll get into why home monitoring is so much better, how to actually do it right, and its amazing power to predict a patient's future. After that, we'll see how it helps us treat better, and we'll wrap up with a look at what's next in the world of BP monitoring.
All right, first up, let's talk about the limitations of what we do in the clinic every single day.
You know the drill. A patient comes in, they might be nervous, they've rushed to get there, and we take one reading. So you've got to ask yourself, is that single snapshot in that one moment really telling you the whole story? Well, the evidence is pretty clear. Not even close.
And here's why that single reading can be so tricky. On one hand, you've got white coat hypertension. You've seen it, right? Their pressure is high just because they're in your office. But the one that really keeps us up at night is the opposite, masked hypertension. This is where their BP looks great in the clinic, but at home, in their real life, it's dangerously high. And that means they're walking around with a major risk factor that we are completely missing.
So if the clinic reading is just a flawed snapshot, what's the solution? How do we get the full movie, not just a single frame? Well, the answer is to bring the measurement home.
This is where home blood pressure monitoring, or HBPM, comes in. It's exactly what it sounds like. Patients measure their own BP at home. And this is a game changer, because instead of one data point, we get a whole bunch of them, over days or even weeks. It shows us what their pressure is really like in their normal environment. Plus, it's way more convenient for them and pretty cost-effective.
And hey, this isn't some fringe idea. This is mainstream. Look at this. The ACC/AHA, the European guidelines, the International Society of Hypertension, they're all on board. They universally recommend HBPM. And they've given us clear numbers to work with. For most of them, if that home average is creeping up to 135/85 or higher, that's your diagnostic threshold.
Okay, but here's the catch. All this amazing data is useless if it's not accurate, right? Garbage in, garbage out. So we have to teach our patients the right way to do it.
So this is the protocol you really need to drill into your patients. It's a simple checklist. First, they need to just chill out for a few minutes, no distractions. Then, they got to sit the right way. Back supported, feet flat on the floor, no crossed legs. Make sure they're using a good upper arm cuff on an arm that's supported, say on a table. Have them take at least 2 readings, about a minute apart. And the timing is absolutely critical. Once in the morning before their meds, and once in the evening. And we need this data for at least 3 days, but a full week is even better.
And this might be the single most important thing you tell them. You have to make it crystal clear. They cannot, under any circumstances, change their own medication based on these numbers. You need to stress that this is a tool for us to make decisions with them, not for them to start self-prescribing. It's a huge safety issue.
Okay, so we've covered the how. Now for the really cool part, the why. Why do we go to all this trouble? Because this data has an incredible, almost scary ability to predict the future.
And you don't have to take my word for it. The research is completely unambiguous. As this paper puts it, home BP provides better prognostic information than office BP. It's that simple. It's just a better crystal ball for predicting things like heart attacks, strokes, you name it.
So how much better are we talking? Well, let's look at a number that should really make you sit up and pay attention. If a patient's morning systolic BP at home is hitting 155 or higher, their risk of coronary artery disease goes up by more than 6 times. That's not a small difference. That is a massive red flag that we can only see with home monitoring.
And this chart really drives the point home for stroke risk. Just look at this. On the left, we have normal home blood pressure. That's our baseline. Now watch what happens as that morning systolic number goes up. It's not a gentle slope, is it? It's a rocket ship. Once you get to 155 or more at home, the risk for stroke is 6.5 times higher. It's a stunningly clear picture of risk that, again, you would totally miss with just one reading in the clinic.
Now, what about when your patient is sleeping? That's another blind spot. There's a condition called masked nocturnal hypertension. Basically, their BP is fine all day, but it spikes at night. And look at the risk here. It's almost as high as someone whose blood pressure is high 24/7. That's a huge deal.
Okay, now this is a really important finding, so stay with me here. What you're seeing is a head-to-head comparison. The top row is data from the so-called gold standard, a 24-hour wearable monitor, or HBPM. The bottom row is from our simple home BP monitoring. Now, just focus on the stroke risk graphs way over on the right. See the top one? The HBPM data didn't find a significant link between nighttime high blood pressure and stroke. But now look at the bottom one. Using the home BP data, the link is clear as day and statistically significant. Think about what that means. In some cases, simple home monitoring can actually pick up on critical risks that even the fancy 24-hour monitor might miss. That's huge.
So this isn't just about being better at predicting bad things. This data fundamentally changes how we make decisions, and that leads to much better outcomes for our patients.
So how does it help exactly? Well, with better data, we can fine-tune treatments to get bigger BP reductions and better overall control. It helps us fight what's called therapeutic inertia, that tendency to not step up treatment when we probably should. Ultimately, all of this means less damage to vital organs like the heart and kidneys. And maybe best of all, it makes the patient a true partner in their own care.
And there's another layer to this. It's not just the average blood pressure that matters. It's the variability, how much it swings up and down from day to day. These charts show it perfectly. Patients are grouped based on how stable their BP is. As you go from left to right, from the most stable group to the one with the wildest swings, look what happens to their risk of a cardiovascular event. It just keeps climbing. So a jumpy blood pressure is a risk factor all on its own, and that's something you can only see with multiple home readings.
All right, so where is all this technology headed? Let's wrap things up by taking a peek into the future, because we're quickly moving beyond that inflatable cuff we all know.
The future is all about continuous, connected data. We're already dipping our toes into telemonitoring, where readings get sent to us in real time. But what's coming next is the really exciting stuff. Wearable devices that are cuffless and give you beat-by-beat readings. Imagine that. Then you layer on AI that can analyze all that data to actually predict who's at risk, letting us step in before there's even a problem.
So that brings us to the big final question, something for you to really think about as you build your career. We are heading straight into an era of what you could call anticipation medicine, where we're not just reacting to disease, we're predicting it. So, how is that going to fundamentally change the way you practice medicine? How will you use this constant stream of data to get to the ultimate goal, which is to get your patients to a future with zero cardiovascular events?